Right? Thanks for listening. You're Dr. Right. You're Dr. Right. You're Dr. Right.
You're a Doctor Right. Take one. Hi, everyone, and welcome to the podcast, You're a Doctor Right, the podcast that's answering all of your burning medical questions. I'm Dr. Sonya Bhole, and I'm a board-certified radiologist. I'm here today with one of my dearest friends, Dr. Lana Kashlan, who is a board-certified dermatologist and specializes in cosmetics. Thanks so much for being here.
Oh my God, thank you so much for having me. I'm so excited.
I'm so excited to have you. So I have to say that Lana is a real life superwoman. So not only does she manage a busy practice in the Chicagoland area, she also sees patients in Dubai and is seriously an international sensation. She also juggles two small kids while doing it all. I don't know how she does it. And she's here to tell us all of the beauty secrets that we all want to know. So I'm so excited to dive in.
Thank you so much for that wonderful introduction. I could say the same thing about you. I don't know how you do all the things that you do.
Women supporting women. This is what the world makes the world go around.
It is.
Okay, so as you know, Lana, the premise of the show is that things that people come up to us and ask us at cocktail parties, right? So or social events. You're a doctor, right? And I'm sure you get way more than even I get as a radiologist, being a dermatologist, because everyone is interested in how do I stay young? So what is the most common question that you get at parties?
Oh gosh.
Before we get started on our episode today, I want to remind all listeners that the content of this podcast is for informational purposes only and does not constitute formal medical advice. Do not delay in seeking professional medical care because of something that you have heard in this podcast. If you have any questions regarding your own health, please talk personally to a doctor or other healthcare professionals. Relying solely on the information provided in this podcast should be done so at your own risk. Now that we're done with the paperwork, let's get started on this episode today.
The most common question that I get is, honestly, people always ask me, so what is like the latest thing, or like what is the best cosmetic treatment that I should be doing? Like what's the latest in cosmetics? People always want to know whatever's new. But the reality is that whatever is like the newest thing isn't necessarily like the best thing for a person. And like that's a big problem that I face all the time when patients come in for consultations, is that they may have heard of a procedure or they have a friend who tried like a certain laser. And so they come in saying like, oh, I want this laser treatment. But a lot of times that's not actually the best treatment for whatever their skin issue is.
For them. So they're different lasers. See, this is something I've always been confused about. So there's different types of lasers for different types of problems or skin. Is that what it is? And so what works on somebody, if you like, I always see my friends have this amazing skin. I'm like, what did you use? And then I try all the same products and my skin just looks like my skin.
Yeah,
right? So
exactly. So you totally like nailed it. Even with skincare, when it comes to thinking about different products, certain products are going to be more beneficial to some people versus other people. So for instance, like I have some patients who have like a lot of redness in their skin, or they have like, they suffer from acne, or they suffer from hyperpigmentation. And so the best products for those skin issues might not be the same across the board, you know? And so I think that a lot of times what happens is patients will be like, oh, my friend uses this and she looks amazing, so I'm going to try it. And the truth is that like, it's not one size fits all. There's a lot of customization that goes into it. And with lasers, definitely. The term laser is just like a generic term for like a type
what does it even mean?
Yeah, so basically just means an energy-based device that uses light to cause some sort of change or to target something in the skin. But the specific target for that light varies depending on the type of laser. So for instance, like laser hair removal lasers are totally different than the lasers that we use for scar treatments or that we use to treat redness and rosacea. So there's like, it's really hard because a lot of times patients don't know that. And so
I didn't know that.
Yeah. So it's kind of confusing. It's a common misconception. People are just like, oh yeah, I had like a laser done, but that doesn't really mean anything.
Okay. So all different types of lasers. Yeah. Like the last time I got my laser hair removal, which I listened to your how to get ready for summer segment on your Instagram. So if the listeners haven't heard that, you should definitely check it out. And one of the things that Lana says is to think about your laser hair removal, which I did think about last summer. And not to kind of pivot the subject, but just to pivot for a minute. My hair has come back. So is that normal? Do you have to get kind of redone every so often, or how does that work?
We talk about laser hair removal as a permanent treatment for
Okay.
reducing the hairs. However, the truth is that it's actually probably more like a semi-permanent solution.
Okay. Yes. I'm finding that.
You complete like a full course, usually somewhere between like 6 to 8 sessions, depending on the body part and depending on the type of laser that we're using for hair removal. But like roughly like 6 to 8 sessions. At that
Okay.
point, you could really have 90% or greater clearance of all the hairs. So it's not going to be 100% clear. You might have a few stragglers behind, but for the most part, it should be pretty clear. And that result usually will last several years. So usually once people hit the like 3 to 5 year mark, they'll find that, you know what, I kind of feel like some of the hairs are starting to grow back. And then they do like a single maintenance session. So at your stage, probably you're at that point where you need to be doing like one maintenance session once a year just to keep everything looking as good as it did. It'll never go back to what it was before, but you slowly start to notice more hairs creeping up.
Okay, well, maybe after this, we can figure out a time for me to come and get a quick laser before summer comes. And then I can see you in person too. So it'll be so
I would
fun.
love that.
So to summarize what we talked about just now, the laser hair removal that they're using on my hair, I cannot ask them to zap my face. They're completely different lasers. And to talk to your doctor about, if you're interested in a laser treatment that your friend might have had, talk to your dermatologist about what might be right for you, because they're all different.
Yep.
Okay, so as a busy mom, I have a confession. Don't judge me, but oftentimes I just put on my face whatever is there. So I have very dry skin. So oftentimes I'm like slathering my kids in Aquaphor and I just put a little on my face. Or, I find like, whatever is left in the small amount of drugstore, whatever I have, and I put it on my face. I do have things I printed out in the past that says, put on your vitamin C and your retin A in the morning, at night, but I just can't keep up with it all. And I can't remember what order to put it in. What, as a busy mom, do I need to do that are the essentials for my skincare?
Okay, you do not need a 10-step routine with like a million
Thank goodness.
things. So you can definitely save your money and your time by paring things down to like the basic essentials. And when we think about like what are like absolute like must-haves every day, honestly, I would probably pare it down to like 4 different products. First is obviously a gentle cleanser, particularly if you're somebody who wears makeup, or honestly, if you're wearing your sunscreen the way that you're supposed to be. Definitely want to make sure that at least once a day you're using a nice gentle cleanser to help remove all the sweat and the gunk from the skin. You also want to make sure that you're using a good moisturizer. Even patients with oily skin need a moisturizer. So it can be a lightweight, oil-free one, but hydrating the skin is really important to help prevent skin conditions like eczema, which we see in patients who have very dry skin or a disrupted skin barrier.
Right.
The thing that everybody needs every single day, even in the winter, even in gloomy Chicago, is a sunscreen.
Okay, I was going to guess that. If it was a multiple choice question, that's what I would have answered.
Yes. So people always ask me, well, what if I'm indoors all day? Yes, wear your sunscreen.
You still need it. Okay.
You still need it. And the reason why is because it really helps us to build the habit. So that way, if there's a day when you happen to be outside all of a sudden, or if it's like you're sitting in your car and it's super sunny, you don't have to worry about whether or not do I have my sunscreen on, because you wear it every day. So you have it on. We know that. And nowadays, like sunscreen development has gotten so advanced that the idea that like a sunscreen is sticky or tacky or smelly, or you don't like the way it feels, like that really doesn't cut it anymore, because sunscreens are so nice. There is definitely
no excuses.
No excuses, even for men. And then at nighttime, you need to be using an exfoliant. And so that exfoliant, most commonly when we think about like for anti-aging purposes, we talk a lot about retinols. But honestly, the exfoliant could even be something like a glycolic acid or mandelic acid. There's a lot of different options.
So the retinol is an exfoliant. It's considered an exfoliant.
Yeah, it
Okay.
is. So
Okay.
when we talk about exfoliants, like we're talking about things that help increase cell turnover. So we really
Okay.
want to basically help that top layer of the skin kind of exfoliate a little bit faster so that way
Okay.
our skin looks brighter. But not only does it make our skin look better, but it actually helps promote the health of the skin because increased cell turnover actually helps make
Mhm.
skin thicker and stronger over time. And so
Okay.
it's basically less wrinkles. So a
Okay.
retinol is a great way to do that. But sometimes people can't tolerate retinols. And so instead, we use things like glycolic acid, which is a really nice, gentle exfoliant, or even like azelaic acid is also a really nice, gentle exfoliant as well.
Okay. So I didn't hear you say vitamin C.
Okay. So here's the story about vitamin
Because I
C.
tend to like, sometimes I'll forget. And then all of a sudden, again, no judgment. This is a judgment-free zone. Sometimes I'll
And
remember
no
and I'll
problem.
find an old one and I'll literally slather it all over my face and then I'll break it out the next day. And I'm
Yeah.
like, ah, because I've been
Common
trying to make up
reaction.
for all the
Vitamin
time I
C
didn't.
can be really irritating for some people. So
Okay.
you're not alone in that. So
Okay.
here's the story with vitamin C. Vitamin C, we love it because it's an antioxidant. And
Okay.
antioxidants are great because just like in our diet, they help to reverse some of the oxidative stress that our bodies face, or basically like the environmental damage that's happening to our skin. Vitamin C topically helps to neutralize some of that.
Okay.
So
That's
it
great.
works hand in hand with your sunscreen to protect you from ultraviolet radiation from the sun and also from air pollution. That being said, you asked me for the bare bones, like must have essentials.
Okay.
So while I love to have a vitamin C, and if you come to see me, I will definitely give you a recommendation for an antioxidant.
Okay.
It's not like my must have. If you can
Okay.
only get one thing on, then I would choose, honestly, I would choose a sunscreen and preferably a moisturizing sunscreen. So that way you can kill two birds with one stone.
Okay, so let me see if I can say it back. Let's see if my memorization skills from med
Because the
school are still
test.
there. Okay, number one, the four must-haves. Number one is a gentle cleanser, sunscreen. Actually, a side note really quickly, you're totally right. There are days that I'm like, I'm a radiologist. I'm gonna be in the dark all day. I'm not leaving the house. And all of a sudden I'm rushing to go pick up my kids and I'm sitting in the car with the blaring sun on me and I'm like, wrinkles, So I definitely agree with you. If you keep it in your day to day, then you always have it. You're always protected. So gentle cleanser, sunscreen, a moisturizer, and some sort of exfoliant, which includes retinol. And in patients that can't tolerate that, then some sort of other acid that they could get from their dermatologist. And if you can add a fifth thing in, then we bring in the vitamin C. But don't slather it on your face, a ton of it when you forget to make up for all the days you didn't do it. Try and do it daily, a little bit at a time.
Oh my God, that was a
Well, did I do
wonderful
it?
synopsis. You are an A+ student. No
Yay!
wonder
I know.
you're
See, I always
radiology.
wanted A's, so I'm
So
very good at
impressed.
memorizing. So
That's
that's
amazing.
good. Okay, so I do have a question about sunscreen. So we talked about how important sunscreen is. What sunscreen am I buying? What sunscreen am I buying for me? And what sunscreen am I buying for my kids? What SPF do we all need? I'm so
Okay.
confused.
Yeah. So the truth is that the best sunscreen is the one that you're actually going to wear.
Okay.
So, just like I was telling you, there are so many different brands of sunscreens on the market. There is
Yes.
really a sunscreen for everyone. So, if you haven't found one that you love, you need to try more because you just
Okay.
haven't been trying enough. That being said, there's a lot of stuff on social media and just in the media in general, making a big deal about whether it's a chemical sunscreen or a mineral sunscreen and which is better. And the truth is that both are effective.
Okay.
So don't stress too much about which particular type of filter is in the sunscreen. The
Okay.
main thing for is SPF 30 or better.
Okay.
And the key with sunscreen use, because the other thing that I hear from patients all the time is they will show up in my office with like a painful sunburn and they'll tell me, well, I was just on vacation or, was just golfing for the weekend, but I put sunscreen on. I put it on. And I don't know how I just still got this tan or I still got this sunburn.
Right.
Key with sunscreen is to reapply. So
I'm going to
if you're,
definitely make Silas listen to this episode. He puts it on
yeah,
one time, sporadically, like very,
I know. They
and
do
then
at
he's
least
burnt.
people are really good if they're going like to be out. People are generally pretty good about putting it on at the very beginning of their day. But
Yeah.
then they forget that like if you're going to the pool, you need to be reapplying like every time you get in and out of the water and really
Yes.
every few hours of outdoor exposure. So
Okay.
the application part is really important.
Okay. So reapply. And anything above 30 is good.
Yep.
And, basically whatever sunscreen you're going to wear and your kids are going to wear, you should do.
Yeah. And for kids, like I personally find that the lotions in my mind, it's like very hard to put a lotion on my kids because they
Yes.
like won't sit still long enough for me to rub it in. So we use there's a lot of sunscreens that come in like a stick form, like it's like a
Yes.
wax.
I love the
Um,
stick.
those are great because literally you don't even have to rub them in. You can just like, catch them real quick and
Yes. Just
all their
quick
faces
little
and and
perfect.
just rub it all over. So those are really, really great. I personally also really like the spray ones. The key though with the sprays is like you do have to rub those in and
Yeah.
to make sure that you get even application. But I think the sticks are honestly for the kids are the easiest. Oh my God. And I just remembered the easiest thing that everybody can do.
Yeah.
And it's actually something that I'm sure most of your listeners don't know about because a lot of people don't know about it.
Oh, I'm so
There
excited for this. Tell us,
there
Lana.
is an oral supplement that you can
Oh.
take. It comes from a plant. It's actually called polypodium. Polypodium is an antioxidant that actually helps protect you from the sun. So sometimes people call it
Oh.
like an oral sunscreen because it really does boost your sunscreen's protection.
Wow.
I don't recommend it as a substitution for sunscreen. However, if it's like a day where you are going to the beach or you're
Yes.
going on vacation and you're going to be out a ton or you're going golfing or boating or whatever, you
Yes.
take this supplement 15 minutes before sun exposure
Okay.
and gives you a long lasting protection. So that way, even if you're not like amazing with your reapplication, you have at least some protection. And men love this in particular. At least my husband loves it because he hates putting sunscreen on. And so
You don't have to
it's like,
think about it. But it
yeah,
only lasts for that day. It's not like
yeah.
you, yeah. Okay.
Yeah, exactly. So you would need to take it. So I do have some patients who take it every single day, and it's totally safe to do that. It's also nice for kids because actually, there's a particular brand where you can actually even give it to kids as young as 3. So that's really, really nice, especially because, like, again, it's really hard to cover up your kids and to protect them as much as you can. I mean, we tried, but like, it is hard.
I love that. Okay. I see why you guys are so excited because I've never heard that before.
Yeah,
That's really exciting. And
it's
I
a
think that's
germ
going to
hack.
really
That's a germ hack.
transform our household. So that's
Yeah.
amazing. Okay. So can you give us a scoop on Botox and filler? Do I need that? Or do I need to keep that up? Is that upkeep? Do I always need to do it? Are there things I need to add on in addition to that? What is like the quick 311 on that?
Sure. So the story with Botox and fillers, a lot of times patients will ask like, oh, at what age should I start doing these things? And I always say there really isn't a right or wrong age. I think
Okay.
when you're at the point where when you look in the mirror, you're noticing these lines or these wrinkles
I'm
that are
there. Yes.
when they're there and your eyes starting to catch them, or if you look at a photo of yourself and that's like all that you can see, then that's really the time to think about addressing it. Both Botox and fillers are the kind of things that you could do them once and never do it again. And it's totally fine. Everything will just go away. It'll be as if you had never done it. So a lot of times people are nervous about like, oh my God, I'm going to have to do it all the time. No, you're not going to have to do it all the time. But what will happen is you're probably going to like the results.
Yeah.
And so then you're going to want to do it again.
Yeah.
And with Botox, generally it lasts between 3 to 4 months for most people. So it's the kind of thing you would do it, 3, maybe 4 times a year. Most people do it about 3 times a year.
Okay.
With fillers, really people are doing it like once or twice a year. It depends also where in the face we're injecting them and like what our goals are.
Okay. So we should do it. And you're right. I'm at the point that I'm thinking I'm seeing everything, right? Like sometimes
Yeah.
in pictures, I'm literally seeing my crow's feet. And the next day I was like, it's time to start Botox. So that's exactly what you said is exactly what happened to me. Like on some of these camera angles, I see my turkey neck and I'm like, where was that? I used to have more definition here. What happened? So it is coming. I see it. And so I think there's a lot of things that are going to be exciting in my future in terms of dermatology and cosmetics. So
We're
we are
ready
here.
for you. Don't worry. Whenever you're ready, Sonya, we're ready.
I know the best dermatologist, so I'm coming your way. Okay, last question for you because I know we need to wrap up here, but I don't get, again, judgment-free zone. I don't get annual skin checks. Yet Silas, who as you know was very light-skinned, was blonde as a child, I send him every year. I'm like, it has been a year, it is time, and I never send myself. Do we all need skin checks? Even if we're darker complexion? Am I
Yes.
a total hypocrite?
You're not. You're not.
Okay.
So for sure, it's undeniable that someone with a lighter skin type definitely is at a higher risk for developing skin cancer. So because they're more high risk, they definitely need to be starting their skin checks, and arguably they need to be starting them kind of at a younger age. So like 18 and
Okay.
up is when you start recommending them.
18 and up. Okay.
Yeah. So once a year, 18 and up, it's a good idea to
Okay.
get your skin checked. That being said, even our darker skin patients do need to get their skin checked because we do see skin cancer, although it is less frequent, but you can develop skin cancer really in any skin type.
Okay.
And that's true for both melanoma, but also non-melanoma skin cancers. Again, even though it's more, it's less frequent, it does happen. So it's a good idea. Also, because sometimes there are things that we pick up on our skin exams that you may not have noticed or that you actually just always kind of lived with. Like the number of times that people tell me that they have like dry scalp. Dry scalp is actually like not a thing. You don't have dry scalp. You have dandruff, but dandruff is also not dry skin. Dandruff is actually something called seborrheic dermatitis. It's actually a medical condition that we can treat.
But it sounds sexier when you say dry scalp.
I mean, yeah, it's like less exactly. Saying I have seborrheic dermatitis makes it sound terrible. And then when I tell you that it's actually from a fungus that lives on our skin, that's even less sexy.
Yeah.
But it is, and we can actually treat it. So you definitely don't have to suffer with it. And so a lot of times, like patients come in for their skin cancer screening, and then I'll tell them, like, hey, like, do you know it happens a lot where like patients will have like white, like chalky nails, and I'll be like, you have like a toenail fungus, and actually like we can treat it. And they'll be like, oh my God, I thought it was just like from doing too much nail polish. And it's like, no, it's actually, that's fungus. We can fix it.
You can fix it. I love it. Okay. Well, I think that's great. I just think it's great that that I've been sending everyone else and not myself, and I should be going too. So
that's usually how it goes though for a mom. Like I feel like we're so good at keeping track and
everyone else in our household on task.
Exactly.
Well, this has been so fun. I just want to summarize everything one more time. We talked about the 4 essentials plus the vitamin C. If you can add in a 5th, we talked about laser hair removal, how you might need maintenance after a while. It might not, just stay like that forever. You might have to go back. I'm at the time that I do need to go back. It's coming back. So maybe just a once a year kind of maintenance. Lasers are different. So all lasers are different. Talk to your doctor about which laser you might need. It might not be the same laser that makes your best friend's skin look perfect. You might need a different one because all skin is created different. Botox and filler and anti-aging, you need it for maintenance. So if you start noticing it in your pictures, it's probably time that you can start going to get it. And then everyone needs skin checks over the age of 18, regardless of skin color, once a year. Go see your friendly dermatologist. Thank you so much, Lana. I've learned so much.
Oh my God, thank you. This was so much fun.
It was so much fun.
Thank you so much.
Fun.